Sandra Bullock's husband, Jesse James, reported to be in sex rehab, out and back in again after multiple reports of cheating. Tiger Woods, of course, addressing the media yesterday as he makes his return to golf since his so-called transgressions, whether it's infidelity, pornography, or other sexual addictions. So what causes it all? We have an expert with us today. Dr. Helen Friedman is a clinical psychologist who specializes in sexual compulsions. Welcome to Great Day St. Louis.
Thank you. I'm so happy to be here.
We have been saying the phrase sexual addiction, and just now we used the phrase sexual compulsion. Is there a difference? And what is sexual compulsion?
You know, I call it compulsive sexual behavior. Some people have trouble with the phrase sexual addiction. They say, well, it's not a substance, blah, blah, blah.
Right.
But in the field, we mean the same thing. Some of us call it sexual addiction. Some of it call it sexual compulsivity.
And compulsive behavior, I can't control it. I'm going to risk everything to do it, right?
Well, and they don't start out and say, I'm going to risk everything. In fact, they don't really want to do that. But there's 3 criteria to tell if it is compulsive or not.
Okay.
Because any sexual behavior could become sexually compulsive. So 1, there's preoccupation where other important aspects of life are neglected. 2, there's a loss of control. The individual vows, I will never do this again,
right,
but does. But think about it, Carol. With healthy sexuality, somebody would never say, I'll never do this again. They'd say, I hope I do again and soon.
Right.
You know?
Yeah,
so
because I love it, I guess. Right,
right, it's different. The 3rd criteria is negative consequences, but the person does it anyway. So there could be loss of marriage, job, health, financial stability, loss of standing in the community.
And this, unlike a lot of other addictions, and even a drug addiction is one that a person has difficulty in admitting. But you say that sexual compulsion, because it's sex, people are embarrassed, more embarrassed than other addictions.
Right. There are people who've said, I'd rather be an alcoholic than sexually compulsive because there's so much shame connected with sexuality, which is a shame. In our culture, we haven't mastered healthy sexuality yet.
True. And you think of people like Jesse James and Tiger Woods, they have it, seemingly have everything, seemingly, you know, we say beautiful wives, and why would they? So what causes then the kind of compulsion that we've seen in those men and other men and women in the country?
You know, that's a really good question. It's very complex. First of all, the partners always end up feeling inadequate. How come you went to someone else?
Right.
But it has nothing whatsoever to do with that.
With the looks, the beauty,
no,
the mansions, it has nothing to do with that.
Nothing to do with that. All sexual compulsive behavior, whether it's sex, shopping, gambling, is used to anesthetize emotional pain. So it's about mood alteration. If you think about the person who does compulsive overeating, for example, when do they stop eating? They don't stop eating when they're no longer hungry. They're probably not hungry to begin with. They don't stop eating when there isn't something interesting to eat. They stop eating when they've achieved that mood alteration. So that's what it's fundamentally about.
Trying to numb the pain.
Yes, but they can't even tell you that. It's so automatic, and it begins in childhood. And everyone who I've ever worked with who's been sexually compulsive had a family history of lack of nurturing. Sometimes there was more emotional, physical, or sexual abuse, but always a lack of emotional nurturing.
But every person who has been raped as a child, who has suffered some sort of trauma, doesn't become sexually addicted, sexually compulsive.
That's correct.
So how do you then treat it?
Okay, so whether somebody has that in their history or not. So some people just have post-traumatic stress,
right,
so say from a rape. But somebody else may be sexually compulsive, and again, it tends to even be a legacy passed down in family histories, but people don't know that anybody else has it because nobody else talks about it. So how do you treat it? First, individual psychotherapy, preferably with a therapist who's knowledgeable about sexual compulsivity. There's also 12-step groups, and we have them right here in the River City. Then there's also inpatient treatment facilities, too.
And it can be treated?
It's definitely treatable. It's definitely treatable. The person may be like an alcoholic, meaning not that they can never have sex again. In fact, integrating sexuality in a healthy way is one of the goals of treatment. But they still might have to not do certain things somebody else might do.
Wonderful. All right. It is a complicated issue that we could talk about for another hour. Thank you so much for joining us, Dr. Friedman.
You're so welcome.
Kent?
Carol, you know, you mentioned some of the celebrities who have been or are in sex rehab, and we asked you on Facebook if you think Tiger Woods and Jesse James have used or are using sex rehab to get help for an addiction, or are they just using it to rehab their images? Well, Lynn says sex rehab, really now. They both need a lot more than that. Amber says that's just an excuse. They got caught. Now they're trying to get out of it. And then there's Melissa, who says, I'm sure there is someone pushing them to go to improve their image. Jesse James already checked himself out because Sandra wouldn't answer his phone calls. He knows it's a crock, and he walked out on it. Wow. Well, coming up on Great Day St. Louis.
You can't wear tie-dye everywhere you go, but you can wear this beautiful tie-dye pendant. And I'll show you how to make something just like it in just a few.
Plus, the city's annual Iron Fork competition gets underway, and this chef hopes to slice his way to the top. Still to come, he's going to show us some of his secret culinary weapons.
Thanks for watching Great Day